Greetings to all. My name is Dr. Alvin Chitterman, and I am the World Health Organization Director. And today I'll be sharing with you ways that we can control the COVID-19 disease outbreak. So this is the outline of the session. We'll be talking about the COVID-19 statistics. Then I'll share with you why COVID-19 is a public health issue. Then we'll look at methods for controlling and preventing the disease. First of all, let's look at the statistics. In 2019, Chinese health authorities were able to confirm the novel coronavirus, and that was because of a recent surge in pneumonia-like cases. Then a few months later, epidemiologists were able to indicate that person-to-person transmission are likely. At the end of January in 2020, the number of cases increased to almost 1,000 cases, and that has been reported in at least 21 countries. At that time, the World Health Organization declared the outbreak a public health emergency of international concern. Then we can compare the months of April and June, and we can see that the number of cases tripled from 2.7 million cases in April to 6.75 million in June. The number of deaths doubled, and the number of countries affected increased. So why is the COVID-19 disease a public health issue? All public health problems will cause significant mortality, and we are seeing this with the COVID-19 disease. We previously saw the statistics on the previous slide. All public health problems will cause significant morbidity. And we are seeing this in the extremely young and elderly patients that are infected with COVID-19 disease, and they need increased hospitalization. All COVID health problems is preventable. Currently, we don't have much information on the COVID-19 disease, but we do know that person-to-person transmissions are possible, and we could use this to our advantage in preventing the disease. So let's talk about the steps in an outbreak investigation. So these are the 10 steps. First of all, we would like to prepare for field work, establish the existence of an outbreak, verify the diagnosis, identify the cases, describe the cases in terms of person, place, and time, develop hypotheses, test these hypotheses, redefine them as needed, and carry out additional studies. Now, these 8 steps were already carried out by our epidemiologist and his team. So at this time, I would like to talk about implementing control and prevention measures, and later I'll communicate these findings. So how can we control the COVID-19 outbreak? We can design early detection methods and be able to detect this disease earlier so that we can limit the spread of the disease. We want to be able to have effective communication strategies to be the first to bring the accurate news out to the public and to do it in an efficient manner. And we want to create lockdown policies. These strategies will help us to plan and to scale up our response to the escalating disease, prioritize areas for implementing control measures, and pinpoint measures to strengthen the response in areas that had not yet been infected. So what do I mean when I say let's scale up our emergency response? We would like to have early detection of cases, and if these persons are positive, we would like to isolate them and treat them. We would also like to do effective contact tracing. We also want to be able to prevent misinformation. There is a lot of persons out there in the public that is spreading misinformation, and we would like to identify this and correct it as soon as possible. We also want to strengthen the national COVID-19 testing laboratories, not only here in the USA, but all around the world. And we want to deliver thousands of PCR tests to persons, to countries that cannot afford it. We'd also like to deliver shipments of personal protective equipment, and so that healthcare providers could protect themselves and be safe, because the health of the country depends on the health of our healthcare providers. We want to prevent miscommunication, so we would like to hire persons that will deal with identifying the sources of this miscommunication and ways we can prevent it. Be the first to bring the accurate information out to the public and to do it in an effective and efficient manner. We would also like to have tighter restrictions, and that is by implementing curfews so that we could limit the non-essential movements in major cities. So we look at the control measures. How can we prevent COVID-19 disease? Well, we can do this by following all public health interventions. So when persons are sick, they should avoid close contact with others. They should isolate themselves. Persons that are asymptomatic, they need to come forward to get testing. So we need to do extensive testing. We need to educate the public on the proper use of face mask wearing, covering their nose and their mouth, the regular use of alcohol-based hand sanitizers, frequent washing of your hands with soap and water. We want to also educate on the proper techniques when coughing and sneezing. We want persons to understand the need to only travel when it is needed, and so we need to have travel restrictions, and we need to promote vaccination as a means of preventing the spread of the virus. Now, these control and prevention strategies were done in 3 countries that had previous epidemics. These countries are Iran, Italy, and the Republic of Korea, and they were able to control the epidemics by following these control and prevention measures. So just like they did, we could also implement it in the other countries and be able to control the spread of the virus. At this time, I would like to call on all countries to activate and scale up your emergency response mechanism. I would like you to communicate with your people about the risk and how they can protect themselves. I would like you all to find, isolate, test, and treat every case and trace every contact. I would like you to ready your hospitals. I would like you to protect and train your health care workers. I am going to leave you with these 3 important words. Let's all be prepared. Let's all prevent the COVID-19 disease, and let's think public health. This is the only way we can have healthier communities. This is my email address. If anyone have any questions, please feel free to email me. I thank everyone for viewing this presentation, and I would like to wish you a productive rest of the day. Thank you.